Namaste and welcome to Thrive, the live chat series. This is your host, Annu Gaidhu, Ayurvedic health practitioner as well as yoga educator. I'm so excited to be talking to you guys today with our guest this week. Her name is Jackie, and she's going to be sharing with us a little bit about diabetes management and what she knows throughout her life and just her professional and personal experience with diabetes and what she can share with us. This is a topic that I've been wanting to know more about, especially since I see clients, and diabetes is something that I feel is not something that you learn until someone possibly is affected by it or you yourself. So while we're navigating COVID times right now and trying to stay fit, stay healthy, I want to appreciate Greeniche Natural Health that's always committed to having this community engagement with you guys, especially with bringing you guest experts every single week with this new live chat series that we have. So without further ado, I'm so excited to introduce Jackie to you all, and we'll hear what she has to say. Awesome. Welcome, Jackie. Thank you so much for joining me today.
Thank you.
I wanted to share with everyone who's listening that Jackie is a registered dietitian, and I'm so curious to know about just how your journey came about and, what landed you in the field of learning more about your specialties and just about nutrition and being a registered dietitian, how that is for you right now.
So specifically, I work with people who have diabetes. So I'm a certified diabetes educator as well as a registered dietitian.
Mm-hmm.
I also became certified in pump training. So I have that specialty as well. But I think over the years, really, I just really enjoy working one-on-one with clients and patients, developing a relationship with people. And just in terms of food and diabetes and pump management, trying to help them in practical ways, ultimately helping improve the quality of their life, whether that's specific to food or diabetes management in general.
Okay.
But I enjoy the opportunity to work one-on-one with people.
Awesome. I wanted to talk about just in general, when I hear diabetes, there's all kinds of things that, come to mind. And I personally haven't been able to experience anybody who has diabetes or is experiencing that. But I just kind of wanted to know if you can explain, I guess, the lowdown about what it is exactly and how that affects an individual's daily living and what that looks like.
So it can really vary. So there's a big difference between type 1 and type 2 diabetes. I think it's important probably to start with insulin and just explaining what that is. So insulin's a hormone. Our body makes it. The beta cells of our pancreas make insulin.
Mm-hmm.
And insulin's job is to move glucose out of the blood system and into the cells of the body where we use it for fuel. So with people who have type 1 diabetes, primarily the cells of the pancreas no longer produce insulin. So they're not functioning, and that's what's leading to insulin deficiency, we call that.
Yeah.
And then with type 2 diabetes, which more predominantly is prevalent in our culture, it's really important to understand the term insulin resistance.
Okay.
And so insulin resistance is when the body doesn't respond to insulin. So insulin's there, but it can't do its job. The body's kind of pushing back. It's resisting the insulin. And then the blood glucose or blood sugar will rise. And in type 2 diabetes, the predominant issue usually is this insulin resistance problem. And they may have relative insulin deficiency, unlike type 1, where it's definitely insulin deficiency. But some people with type 2 diabetes do have a predominant insulin deficiency issue with some insulin resistance. So it's more like a spectrum.
Okay.
Whereas with type 1 diabetes, there's definitely insulin deficiency.
And so just as
the range.
Yeah, I was gonna say, I guess, would you say it's more so dependent upon, it's unique to everyone's situation and how they've come to manifest or have to deal with this issue? Is that right? Like you can't really have a prescriptive way of dealing with diabetes per se if it's on one end of the spectrum versus another? Is that right?
Yeah, I mean, there's certainly a general sort of practice guidelines, but that's where getting into the nuances and again meeting with people one on one, we can really sort of dig down and figure out what's going on in their personal situation, and whether it's dietary strategies or lifestyle strategies to help improve their blood sugars, or in terms of type 2 diabetes, sometimes anti-hyperglycemic agents are needed to help, ultimately with the goal of keeping their blood sugars well controlled. And that's what's going to prevent the complications of high blood sugars over time.
High blood sugar. And for you, what was I guess what was it for you that made you passionate about this career in education, specifically for diabetes initially?
I think probably during my internship. So to become a registered dietitian, you go to an undergrad. Mine was at University of Guelph in a Bachelor of Applied Science. And then I did an internship in Edmonton at Capital Health Authority. And there is where you sort of experience the different areas of potential places you could work. And I just really enjoyed the time I spent with helping people who had diabetes understand the disease, understand what they could do, help them feel empowered that they could make changes or make choices that could really influence their health. And I think that's probably where it started. And then just over the years, meeting people, particularly more with type 1 diabetes, and then all that's involved in that, and helping to there's so many different things that can affect the blood sugar. And I think we place a lot of emphasis on food, but there really isn't such a numerous things that do come into play with blood sugars. So yeah, helping people really fine tune things by understanding that and working with them to figure out what they can do to just improve things for themselves.
I really loved what you said, because it really isn't all a one size fits all solution, you know? And so I find education, especially being able to share with people exactly what you had said, that it's not so much just about the nutrition piece, that there's other aspects of it that contribute. And for Ayurveda, that's similar, that we look at, you know, the holistic aspect of an individual to see how you can support them in their journey. And I wanted to ask you, just because of my own ignorance per se about the subject, what are some common, if somebody doesn't have diabetes, what is the way that they would come to know that they have it at that point? Like, is there some symptoms that you would experience, or is this something that can go on for years without you not knowing?
I think, unfortunately, it's probably the latter. For a lot of people, they don't necessarily feel symptoms as the body tries to combat this slow rise in blood sugar. And it's not like you wake up one day and you have high blood sugars. It's kind of, particularly with type 2 diabetes, type 1 diabetes is quite different. But it's a slow general rise in blood sugar. And so the body does try to keep things under control. And over time, it just doesn't have the reserves and the ability to do that. And so there's a tipping point where you do move into those ranges of blood sugars that put you in that type 2 diabetes category. But what typically would bring someone to the doctor would be an increase in thirst, increased urination, frequent urination. They might experience a bit of weight loss. But those would be typical symptoms of hyperglycemia, is more the thirst, excess urine, sometimes nausea, vomiting, bad breath, like a fruity odor in the breath, or dry mouth can also be symptoms of hyperglycemia.
Okay. And I mean, for somebody who wouldn't know, what are some possible complications that could occur if you do have diabetes and you're looking to get support with that?
So when you have hyperglycemia, so high blood sugar for a long period of time, over time, that if you can imagine, the blood is stickier or thicker. It's sort of like a corn syrup versus a water consistency when the blood sugars are higher. So long term, that's going to lead to microvascular complications. So that's the small blood vessels in the system, and that can affect your eyes, which causes retinopathy, the kidneys, so nephropathy, the nerves, so neuropathy. Those are the microvascular damages.
Okay.
And as well, there's an increased risk for macrovascular disease. So that could be coronary, cerebrovascular, or peripheral disease.
Wow. Um, just to throw it out there, can you be born with diabetes? Is that something that's possible?
So definitely there's a genetic link. So with type 2 diabetes, there's actually a strong genetic link for type 2 diabetes. It is largely a lifestyle disease though. So whether it manifests itself or not, and part of the genetic link and the lifestyle piece, I think is that you're born into the family you're born into, and a lot of their influences affect your lifestyle and how you go about your eating and your activity, your sleeping, your stress management. And so yes, but there is a strong genetic link, and there's certainly populations that are at higher risk. With
Yes.
type diabetes, type 1 diabetes, it's primarily an immune mediated response. So it's likely initiated by environmental factors in people who are genetically predisposed to it. So there is a genetic link, but it's mediated by that environmental influence.
Thank you, because I was curious about that to see if there is any difference when it comes to even culturally, if there's cultural distinction, and could you tell me more about that?
So certain populations are definitely at a higher risk, including African, Arab, Asian, Hispanic, Indigenous, South Asian, also people in lower socioeconomic status. Those populations are definitely at a higher risk, and so there is a genetic link there.
What's your theory about how that came about? Would you say maybe it's like environmental influence at that point, or is there other factors?
Likely, I think. Yeah, I'm not a researcher. I certainly I could speculate, but I think largely a lot of these populations that had a certain way of living and way of life that so drastically changed with Western influences. They're just genetics aren't set up to allow for that. So definitely your environmental influences plays a huge role.
The reason I was asking and I'm smiling is because I know in my culture, the amount of sweets that you have and the amount of just delights that I feel possibly back home, because we use a ghee and more natural foods that go into a lot of the things that we make. Whereas here it's not as I guess you can say refined down to that purest essence, to be able to receive such a thing. And that's why I'm curious, because I'm like, I wonder how it would look like when we have so many laddus and different types of specialties in our culture, if that could be something that would influence it. And I wanted to ask you something else just about diabetes in general. Let's say if you are somebody who is experiencing that, does that also mean that you're at higher risk for other medical problems that are directly perhaps related as a result of diabetes?
Certainly. Well, as I mentioned earlier, having diabetes, if it's not managed, so if the blood sugars are left high over time, is when you develop those microvascular and macrovascular diseases. But the other side to it is if your sugars are high, you are at a higher risk of infection, and you do have slower healing. So no matter what condition or disease, inflicts a person, if their sugars are high, they're going to have a harder time getting things under control.
That makes sense, I guess, because the body is almost like having to work double time, in order to sustain what's going on. And I guess, how can a person reduce their risk of diabetes? And if you were to share some pointers for anybody that's listening, what's your go-to recommendations?
So certainly at the earlier stages, so someone maybe with pre-diabetes, and there are certain blood sugar ranges where that can be diagnosed. So if it's caught early enough, or someone newly diagnosed with type 2 diabetes, Weight loss is probably the most important and effective strategy if they have overweight or obesity. So a weight loss of even just 5 to 10% of your body weight can help to normalize blood sugar levels. So that's key. And I always say that's one tool in the toolbox, and the goal being normalized blood sugar levels.
Mm-hmm.
So there's weight loss, regular physical activity is really important to reduce the risks of diabetes. And if healthy behavior changes, whether it's healthy eating, physical exercise, aren't enough to normalize the blood sugars, then there's the anti-hyperglycemic agents, right? A variety of different medications in the toolbox to help normalize the blood sugars. And, bariatric surgery is also playing more of a role in prevention of type 2 diabetes these days for people, I guess, more in high risk groups. I guess currently the cost benefit analysis of surgical interventions kind of remains questionable, but that is a tool, and some people do find it effective for them. So it's important to include in the conversation if someone is open to that.
You had mentioned before about just the distinction with type 1 and type 2 diabetes. And so I wanted to ask you, is there like a different type of remedy or lifestyle remedy that you would recommend for somebody who has type 2 diabetes versus type 1? Is there a distinction between them, or is there, are they kind of the same type of lifestyle recommendations you would advise?
Yeah, fairly similar. I always initially used to think these poor people that were diagnosed with type 1 diabetes, all of a sudden now they have to do all this lifestyle stuff.
Yeah.
But over the years, my thoughts about that have changed, because it's actually good. It's good that they have to be more aware. Yeah. And over time, it can make it easier for them to control their type 1 diabetes if they do engage in lifestyle behavior modifications that really, I say if most people actually lived a lifestyle that we encourage people with type 2 diabetes to live, we probably would eliminate a lot of chronic health conditions.
Absolutely.
Yeah, so a lot of the messaging with lifestyle is the same, whether you have type 1 or type 2 diabetes.
And how often might a type 2 diabetic check their blood sugar levels?
So that's really going to vary depending on what, of course, the type of diabetes. So type 2, if they've just been newly diagnosed, I use it as a strategy to really help them become more aware of how their food choices, their food portions, their exercise, their sleep, their stress, how that all can influence their blood sugars. So initially, I actually do encourage people with type 2 diabetes to do it a little more frequently. Certainly if they're on certain medications that have a higher risk of causing hypoglycemia or low blood sugar, we do increase the recommended times per day. But initially, if people can check right before a meal and then 2 hours after a meal, that's a really good picture of how their body's doing with those foods they're eating. And it's a good place to start a conversation and to explore, why do you think that would happen? And helping them become aware of the different components in the foods they're eating, the different nutrients, and how that's influencing their body and their body's ability to manage the blood sugars.
That's really interesting, because that leads me to my next question that I was going to ask you. But just before that, a thought came to my head. In general, when it comes to the warning signs and symptoms, if your blood sugar is too high or if it's too low, but prior to that, how would somebody check in general to see how their blood sugar is doing? Like the average person, if they wanted to see, is there like a tool or a machine, or would they have to go to the doctor at that point just to know what the accuracy could be?
People with diabetes in general, or just anybody?
Anybody. Like I'm wondering if, like, let's say perhaps me, if I wanted to check how my blood sugar levels are doing, if it's too high or if it's too low, how would I be able to go about doing that exactly?
So, of course, for people who have diabetes, when they come to our clinic, we set them up with a glucometer. So it's just a little machine to poke their finger, and that gives them a blood sugar reading. So whether you wanted to buy one, if you don't have diabetes, that certainly they're available at the pharmacy. Many insurance companies will cover the cost of the test strips, which are pricey. And so if you don't have a prescription for that, then, you want to be very, I guess, cost effective in how you use them, unless it's not a problem for you. But yeah, you can pick them up at the drugstore. We teach people how to use them in the clinic. And now there is other options with flash glucose sensor technology and continuous glucose monitoring. So there's new devices on the market now. A lot of people probably have seen commercials with the Freestyle Libre, a little sensor you wear in the back of your arm. Dexcom is a CGM, so continuous glucose monitor you wear on your abdomen or lower back. And these technologies check the glucose every 3 to 5 minutes.
Wow.
And so you can have continuous picture of how your sugars are 24/7 if you had one of those technologies.
Awesome. And just what's your recommendation for people who are listening? As a registered dietitian, what's something that you would recommend as a tool for people? Would you recommend those technologies where you can see it more up to date, or going to a doctor?
For anybody, or for someone with type 2 diabetes?
Type 2 diabetes.
No, I don't know if it's necessary. It can be overwhelming. I think initially for people when they're newly diagnosed, it's kind of a lot of information. So I do kind of, again, back to that just one-on-one, getting a sense of where the person's at. Yes. And, sometimes that's not even a discussion at the first interaction, or it's not something I go through if they're not ready for that or they're feeling overwhelmed. So it just really depends on the person.
That makes sense. I wanted to ask, what would an average diet of a type 2 diabetic look like? Or not diabetic, but somebody who's experiencing diabetes. What would that look like for them? And are there any foods with unexpected risks that we may not know about?
So really, there are a variety of diet patterns and specific foods that have been shown to benefit people with type 1 and type 2 diabetes. They really should be encouraged to, I guess, follow a pattern that best aligns with their values, their lifestyle, and their treatment goals and their preferences, that really allow them to adhere to it long term. And that's what we found is it's not about the zone diet or the South Beach diet or the keto diet or the low glycemic index diet. It's what can you do today, but also do for a lifetime. So for me, a diet isn't like a 4-letter word. It's just how we eat. That's the diet. And sort of diabetes friendly eating habits, if you want to call them that, would be to prepare meals at home, trying to use unprocessed foods, most often unprocessed ingredients, limiting refined and processed foods like sugar sweetened beverages, fast foods, processed or refined grain products. Trying to prepare meals and eating together with family or friends. It's a social piece. And if you have children, you want to kind of instill good habits and model that behavior, which can really help to reduce their risks long term of becoming overweight or becoming, developing higher blood sugars long term. You want to pay attention to carbohydrates. So carbohydrates are the components in food that will increase our blood sugar the most heavily out of the different macronutrients. So carbohydrates, proteins, fats. So you want to kind of watch the carbohydrate quality as well as the quantity. So it's not just about the portion. You want to choose wisely. And that gets back to the less processed, the less refined, and choosing lower glycemic index carbohydrates has been shown to be helpful. So this could be things like barley, bulgur, quinoa, those whole grains, legumes, fruits and vegetables. Those are all sort of lower glycemic index carbohydrates.
That's great, because I was just thinking of myself and possibly what other people would be thinking, that, especially now with COVID and the situation of being at home, what a blessing in a way that you get to be more conscious of what you're doing and slow it down a little bit. And for me personally, it's been really bringing more awareness into the foods I eat. And so something that you had mentioned just about really looking at that and being able to see the quality of the food that you're intaking, especially the quality of the carbs, like you had mentioned, and is it refined or if it's not. And so I was thinking, having an active lifestyle, like I love sugar, so any type of thing that I can get that's going to give me just that little bit of, energy, I feel like works for me. But what would you recommend for someone who has diabetes and, is having a little bit of a challenge maintaining an active lifestyle meanwhile, or a busy lifestyle meanwhile, also their health?
So certainly physical activity is so important for overall health and for helping to control blood sugar. So you definitely want to be including that. But that can stir up your appetite, right? That can actually make you hungry, which isn't a bad thing if you're choosing foods wisely. So, a quick piece of fruit is just as quick as a couple cookies. But definitely going to give you lower glycemic index. It's loaded with fiber and vitamins and minerals versus the cookie, right? So they're both going to help bring your sugar up, but the nutrient density is just so much better in whole foods. But you do need more caloric intake. So when you're being active, your caloric requirements are going to be higher to maintain a healthy weight. So that doesn't all come from carbohydrates. We want to have a balance of the protein and fats as well to kind of have balanced meals. And one thing I always encourage my patients who are living with diabetes to think of each eating opportunity as a chance to get that balance. So you want to try and get something with some protein, some healthy fats, something high in fiber. And typically the food that's high in fiber will give you a bit of carbohydrate. So whether that's whole grain, brown rice, corn, barley, bulgur, like we talked about, or if it's more vegetables and fruits, those foods will all give you fiber as well as some of those low glycemic carbohydrates.
Awesome. Well, thank you so much, Jackie. I think this was so valuable. And for me, especially, I'm more aware of, especially this piece around awareness and the quality of the food and just being more mindful of your lifestyle. And so I have,
so important.
Right? Yeah. And so I feel like, I have tremendous respect for anybody who's educating the community in that way. And so thank you for sharing your time today with me, as well as your knowledge. It's so appreciated.
Oh, you're welcome. Thanks for having me.
No problem. And I hope that you're welcome to any questions. If anybody has anything related to today's talk, if they can, message me about it, and then hopefully I can hear back from you sometime to answer those.
Sure. I'd be happy to.
Awesome. There you have it. That was Jackie, registered dietitian, sharing with us her best tips on how you can manage diabetes as well as lifestyle recommendations. This has been your host, Annu Gaidhu. I also want to remind you guys that we do have a giveaway. By watching this episode, you're entered automatically to win an e-gift card to use online at www.greeniche.com with a prize pack from our guest. The winner is going to be announced in our Facebook group as well as our newsletter, so don't forget to sign up after this. Thank you so much for spending your time with me today. I enjoyed it, and I look forward to sharing with you more interviews with more guests together. Take care.